Now, being the 1st of December, stigmatization and lack of awareness among the youth have been termed as the biggest contributor to the spread of HIV and AIDS in the country. Stakeholders who spoke during the commemoration of the International AIDS Day have called on communities to stop subjecting people living with HIV to stigma and instead offer them full support.
As the world marks the International AIDS Day, stakeholders are decrying increased incidents of stigma on people living with HIV. The stakeholders say they have identified stigma and lack of awareness among the youth as the biggest threat in the renewed efforts to reduce new infections.
Hawa watu wa mikingo, watu wengine wanaona kama si watu. Kila tumetaka ni kukaa pamoja naye na kusema mambo mazuri. Na kuongea mambo mazuri na kuona hawa ni watu kama wewe, watu wa Mungu.
They have information, some have shallow information, the rest have good information because I believe wanasoma a unit on HIV, but wakikuja kwa the community, with as the community, how do we partake this issue of HIV?
The national celebrations are being held at the Kinoru Stadium in Meru, and the National AIDS Control Council says government has re-engineered its efforts to prevent new infections and give proper care to those living with HIV.
The government has set the way. It has shown the way of having an insurance scheme that does not discriminate or exclude people based on their disease. So we are asking also the private insurance to follow the same suit.
Meanwhile, Laikipia County has recorded increased cases of new infections in mushrooming urban centers. Dr. George Mochama, the HIV program coordinator at Laikipia County, says heavily populated wards are leading in new infection rates, contributing to over 65% of cases because they harbor urban centers.
Out of that number, we are proud that we've been able to identify close to 10,000 of them, and they are currently receiving treatment in various facilities within Laikipia County.
The county has graduated mothers living with HIV alongside their children who are HIV negative through a special 2-year program where they received care from different medical facilities in the county.
Without intervention, they have 60% chances of infecting their children. But with intervention, these chances can be reduced to near zero.
Jacqueline Masharia for Lunchtime News.